We have Chinua Sankar, who's epidemiologist, who's with us, and we have Alara Ali, the project coordinator, from joining us from Baidua. And I know that Alara is sitting in a room where next to that wall there is a hospital where there are children being admitted at this moment and being treated. So we're going to start now. The format of the press conference would be very simple. We will request all the spokespersons to speak for some time. And towards the end, we will have a session for question and answer, questions from the room and questions from people online as well. Mitch, can I request you to begin and give us paint a picture for what our teams are seeing in Somalia broadly and in Baidua specifically, please?
Yeah, sure. Good morning, everyone. On a wider context, I'm very afraid that it's also a very grim picture. It's not been an understatement when I say that severe humanitarian emergency is unfolding right now in Baidoa, and across the country. There's an ongoing drought that has been declared since last year. There's a severe shortage of water reported across many regions. Crop failure across multiple seasons. Loss of livelihood, loss of livestock, they have all been documented. And this is pushing many of the vulnerable populations beyond the level of survivals. And this is happening in a context which has witnessed years and decades of conflict, of insecurity, widespread displacement, and overwhelming dependence on humanitarian assistance. If I give some of the data, according to the IPC, which is the food security phase classifications, the most recent analysis between April and June, it estimates that around 6 million people are at the risk of acute food insecurity. And this is 1/3 of the whole populations of the country. And 1.6 million are at the emergency level of food insecurity. So these are the populations which needs urgent assistance. And if you look at this year, the first 3 months, there has been reported of over 500 million people has already been displaced. And this number is only increasing. Many of these displacements are driven by drought, 90%, and overwhelming 80% of these populations are mostly most vulnerable women and children. In Baidoa, in Southwest State, we are witnessing this firsthand. On a weekly basis, we see families, we see new arrivals pouring into the town. And these populations are coming into the town after they have lost everything. And they're coming to the town in search of food, shelter, and for the survivals. In Behau regional hospitals, where we are supporting the state referral hospital, we are seeing an alarming increase in the number of malnourished children that we have admitted since January. Like what my colleague Nasir mentions, in beginning of the year, we started with 50 beds. That was our bed capacity for nutrition's ward to treat malnourished children. Gradually, we have to expand our bed capacity from 50 to 70, from 70 to 100. And during the peak in June, we have already expanded to 120 beds. There is no more space for us to expand our bed capacity. And last time when I visited Baidoa 1.5 months ago, I saw this reality. Our ER, our pediatric ward, our nutrition ward, even the part of our surgical and maternity wards are filled with malnourished children. And this is the reality. And it's not just the numbers alone, like it's also the severity of the cases that we are seeing in the hospital. Like 90% of these malnourished children, they are present with medical complications that require specialized medical treatment. And we are running out of space. And our team on the ground, they have to make a very difficult decisions every day, who to admit and who to discharge. And of course, we have to discharge the least severe cases, only to be readmitted again after a week when they go back to the environment, and then when there is no food, when there is no clean drinking water, and then they present with complications, only to be readmitted again. Unfortunately, we're also seeing an increase in the number of our mortality cases. It means number of deaths in the hospitals. Many of them, of course, are attributed to infectious disease among the malnourished children. And this is not just the numbers that we are seeing in the hospitals. Also outside of our hospitals, we are seeing where we also have programs in our outreach programs, in our outreach in the health post. We are seeing the same observation, the increase in the number of patients. Like this year alone, we have admitted around 22,000 patients in our nutrition programs. And that's more than double than what we saw last year. And I also forgot to mention that our inpatients numbers, the patients that we have admitted this year, have already exceeded by 80% as compared to last year. And this is the reality. And with these concerns, in July last month, we did this rapid nutritional survey, but my colleagues will talk about it. But the survey that we have done, it confirms what we have feared most. And and what we are seeing is the widespread concerning level of malnutrition. And here I also like to mention that this is not an isolated event that we are seeing only in Baidoa. Even in other MSF projects, for instance, in Muduk State, in Galkayo town, we are seeing the similar observations. Like since the last 2 months, there has been an increasing number of acute malnutrition cases. And under this backdrop, what is most concerning is that during this time, when there's an urgent need for a massive scale up of the nutrition programs, of the food assistance programs, but we are seeing a big reductions or the lack of interest or lack of attentions to the humanitarian crisis that's unfolding in Somalia. For instance, like in the 2026, this year, humanitarian response plan, there has been a reductions in 40% of the budget. And even with these reductions, only 1/3 of the fund has all been realized till this month. US, which was one of the biggest donors to the country, like last year, they funded close to 70 million USD for the humanitarian programs. They have totally stopped funding since last year, and along with other big donors. And these are the impact that we are seeing firsthand on the grounds in towns where we have our presence, like for instance, like in Baidoa. And all of this, we are seeing direct impact. We are seeing, it has been reported according to the health cluster that more than close to 40 health centers has been closed down in town where there is an overwhelming need when there is a crisis. And we are seeing this impact directly in our hospitals with the increase in the numbers and severity of the cases. And many of these children could have been prevented if they have access to the food or access to the vaccines. So we are seeing unnecessarily preventable deaths in our hospitals. In many ways, according to the IPC, what we are seeing now has been compared to the 2022 drought, where more than 2.6 children are needed to be treated before the end of the year. But the only difference as compared to previous drought in 2022 is that this time there has been 88% reductions in the donors' funding, and to be able to respond to the overwhelming crisis that we are seeing today. So I think it's very clear from what we're seeing on the ground, there is no enough food, no enough water, no enough healthcare. And as MSF, we are trying to scale up, but it's not enough. It's like to focus only on the healthcare. What the population needs is the food assistance, is the livelihood support. Like we need to break this vicious circle that's going round and round. Like we have been readmitting the patients, and this needs to be broken. So let me stop here and then I can come back if there's more questions on the context. Thank you.
Thank you, Mitch. Mitch mentioned that there's more than 500,000 people are displaced this year in 3 months, and 90% of them are due to drought. And if we look into the figures of UNOCHA, 80% of these people are women and children. So the drought is displacing people, and what it is displacing are women and children, and impacted much. And he also mentioned the comparison between the needs of 2022 and now It's a similar needs as per the IPC data, but the funding or the support that the Somalia getting is far less. Thank you so much, Mitch. I will request Noah. We are seeing this situation in the hospital that there are influx of patients, but what is the situation outside? And MSF did recently a survey. Can you enlighten us on this?
So as Mitch has said, what we were seeing in the hospital and in our outpatient facilities was sort of what formed the rationale for us carrying out this survey. We wanted to have something a bit more representative, and we wanted to try and understand what the situation was in the community, and also not just the situation in terms of the nutrition, but their general experience and some of the challenges that they are facing. So we surveyed approximately 888 households across 14 different displacement sites. So we tried to create as representative a sample of the population in Baidoa as possible, and within the confines of the security situation. And what we did find was that every second child was acutely malnourished, and of those, 1 in 4 was severely acutely malnourished. And severe acute malnutrition means that these children are incredibly vulnerable. They are susceptible to infections that otherwise would not be life-threatening, and that puts them at a great amount of risk. And as Mitch mentioned, we're seeing a lot of complications as a consequence of this in terms of the hospital admissions in our inpatient therapeutic feeding center as well. Again, the mortality prevalence has increased inside our hospital, and we are seeing a similar pattern in the community over the past 3 months as well. So in terms of the food security situation, it has exacerbated, and it's gotten significantly worse in the last year, according to what the community members are reporting to us. So about 88% of the families that we spoke to said that their main source of income is either daily or casual labor, and a proportion of that are relying solely on humanitarian assistance, begging, and just asking family members that are outside of Baidoa for general support. And that's putting them at a great amount of increased risk for shock. So when anything changes in the situation, a single day of going out into the community and not being able to get that daily labor means that the family doesn't eat for that day. And it is as simple as that for a lot of them. 99.5% of the households also reported that they primarily relying on dry grains. So the composition of their diet is primarily cereals and grains. Only about 1% reported having access to vegetables, and even that is through some basic subsistence farming that they are able to do themselves with some basic drip irrigation if there are water trucking services available in their area. But no households that we interviewed in the survey had any access to meat, poultry, fish, legumes, fruits, so oils and fats. They had absolutely no access to any of these items. We also went into the markets ourselves, and we could see the scarcity of the items in general, and we could see the inflation as a consequence of people just trying to get those items into those areas, and specifically into the internally displaced camps. And that was a really big issue for a lot of the families. So with that level of dietary diversity, it's not that surprising that this is what we are seeing in our facilities, and this is the condition in which children are coming into the hospital overall. So in addition to the labor scarcity, and that being their only sort of daily living allowance that they're able to get, there were also areas where there are no water trucking facilities. There's no water trucking being done either by MSF or other actors. And a lot of those community members are reporting that it costs between 5 cents to 20 cents per jerry can. And for them, that means that if they buy that jerry can that day, that food is not an option. So it becomes a very simple choice of whether they're going to choose food that day or water. And there have been also reports from a lot of those families about the cleanliness of that water, depending on what borehole they're accessing and what's available in their area, because transporting goods between either whether that's food or whether that's water is incredibly difficult for them, and it's incredibly costly as well. Some of the women that we also spoke, if you are generally too weak to be able to do daily labor, that's also creating a huge number of vulnerable populations. So whether that's the elderly, whether that's child-headed households, grandparent-headed households, if you are generally too weak to be able to do any daily or casual labor, it just very simply means that you will rely on community members for any support that you can get. And it often means that they spend whatever time that they have begging in the markets for anything, whether that's food, whether that's some form of cash assistance as well. A lot of the mothers have also told us that the daily diet for their children just includes sour gum and rice. And one mother said that what she does is she dilutes the rice with as much water as she can to extend the number of meals that she can provide for the family for that specific day. So a lot of them are coming in with very severe acute malnutrition because of this. And that's why we're also seeing a lot of cases of edema in general. And we are seeing a huge number of readmissions. So our data did show that about over 60% of those children who had been enrolled in a program, any program, whether that's outpatient or inpatient in the last 12 months, over 60% of them had been more than once. So whether that's a relapse or a readmission, they had been in and out of the program more than once. And the mothers are very despondent when you speak to them because it's almost inevitable that the child is going to be readmitted at some point, and there's very little that they can do to control that. And for them, like Nasir had mentioned, a prolonged stay in a hospital does sometimes mean that they have access to things that they otherwise wouldn't if they were to be discharged from that facility. And I think just the last point from me, when we were speaking to a lot of the camp leaders as well, they are quite frustrated by the situation. They're frustrated a lot by the humanitarian setting and the lack of aid, and also just how inconsistent it is. So a lot of them mention that, you know, somebody might come in and provide some assistance for 3 months and then stop. And then they don't know how long it will be before that actor may or may not return to their community and provide that support again. They also don't know how much support they will get each time. So it's very variable, and they are also asking for more sustainable solutions from our end and not sort of inconsistent aid that comes and goes, and they never able to sort of predict what's going to happen next. And that inability to predict what's going to happen next is leaving a lot of them feeling despondent and not very hopeful of the situation getting much better.
Thank you, Chunwa. It's shocking, as simple as that. Every second child is malnourished, and as you said, every fourth child is severely malnourished. And it's also consistent with the surveillance that MSF teams have been doing since the beginning of the year, where they have screened over 21,000 children across Baidua town, and the malnutrition rates are around 50%, which is half of the children under 5 in Baidua are malnourished, mainly driven by drought. But we cannot forget the insecurity and the conflict that Somalia in general and Southwest State and even Baidua town that is suffering. There is ongoing conflict that has been affecting, and obviously, as you know, the insecurity and conflict only worsens the situation, but also prevents people to access healthcare. It also prevents health actors and organizations to reach people. So it's only a contributing factor. Moving on, I will request Alara. Alara, this situation and then to respond to it is obviously a shared responsibility from humanitarian actors, including MSF. We see what we are doing, what needs to be done, what we are seeing on ground being done by other organizations, by authorities, and what is the solution and the way forward to that.
Yeah, thank you, Nasir and the colleague and everyone. We need to put attention that what we are talking about is happening now and it's not finished. So first, the knowledge about the situation, and then second is the response. We can describe by using multiple wordings and scientific words, but it's very, in conclusion, it's not an easy situation for neither the population and the frontline humanitarian like our case. We are majorly a medical organization, but we are affected by all the other non-coordinated response or absence of funds and shortages of humanitarian support for the population. So we are seeing, of course, in the hospital a lot of sick children and life losses that can be prevented if the proper action have been done. So we call for a serious assessment, and at the same time, coordinated response in multiple level in health sector, in nutrition specifically, from all the actions that can help, starting from assessment to expanding the activities that need to be done facing this situation, from increasing bed capacity on the passive part, and at the same time to increase the services for moderate acute malnutrition on more proactive and preventive part. This part of the service is very much connected with other services on the community, which is food distribution, as all the causes of this are food shortages, and that's why you end up with malnutrition prevalence is high. When it combined with outbreak, then you will have the worst combination that you can have for the lack of vaccination for preventable diseases. So we are not only calling for all the donors to come together and all the humanitarian partners to scale up to face the emergency, and also to put the program to prevent such situation from being repeated in the near future or on the next years. So when we speak about malnutrition, we also want to prevent any combination with other outbreaks, where we need to have highly coordinated vaccination campaigns. One of the shocking factors we are seeing in the hospital, where a mother can lose 3 of her children in 24 hours because of preventative disease like measles. So here you will have it clear when you are between the hospital beds or talking to mothers who are holding their sick children, which all can be prevented with the malnutrition or the comorbidities that come, such as outbreak. So we call for, of course, international donors to come and intervene in the current emergency, as whatever happened and resulted after the funding cuts and hit by a drought and all the impact on the humanitarian context can still be responded to by upgrading the level of first emergency response, and then second, what kind of program that need to be implemented to prevent going on the same cycle. As Dr. Mitch mentioned, and also my colleague Shinoa, it's not only coming from one sector like health responding to the consequences of the other sectors. Wash and water and sanitation is very important and crucial for the community, where community in Baidoa had to choose whether between buying food or water. Of course, every human being will go for the first line, which is obtaining water. So here comes the necessary and life-saving water activities in the community. So it needs to be coordinated action by all the partners from different sectors to prevent reaching to children and mothers losing their life, and also elders and people from vulnerable categories like disability and other community members. We have seen also most of the impact in the hospital, where everything have been squeezed, and our response was just to put the cold patch on a wound that need to be treated in a different way. It was not only as a result of funding cuts alone or the drought alone, but all of the factors that we can control and not control together. What we are calling for, talking about mothers and children from the field, is that scale up is life-saving, scale up is needed in first starting by the medical, of course, activities related to malnutrition and other supported medical response, outbreak and diseases control. But we also call for food distribution and livelihood support as a full circle of facts and elements that could either prevent or worsen the situation on the ground in Baidoa. I think we are seeing a lot of basic needs that are missing, but at the end, we are here to talk about the medical part that we mostly see, but it's all coordinated together. If you discharge a baby with his mother to go back to the community, hoping that he will have enough food and at the same time to be released from the malnutrition. But meanwhile, one of the stories I've heard that the priority of food also comes in, and the priority of vaccination, and the priority of livelihood support and food distribution. This is it from my side, Nasir. Thank you very much.
Thank you, Lara. Quite comprehensive call for action from you. Just to conclude, like we said, the hospitals are overwhelmed, the needs are surging. And when we say that every second child or 50% GAM rate, the global acute malnutrition, or 25% severe, these are statistics, but behind these statistics, there are children, there are women, there are families who are waiting for assistance. And we cannot say, we cannot wait that there could be a declaration of famine before the world acts. They cannot turn a blind eye. And at this very moment, the Somalia broadly and Baidua Southwest State needs support from the international community. Like Alara said, be it expanding the inpatient treatment facilities, treating moderate children so they don't go into life-threatening condition, water and sanitation, food assistance, and all these things which are very important. I would conclude here, and I will open the floor for any questions from the colleagues. We can start from the room, and then we can see if there are any questions online as well. Yeah, please.
Thanks so much. My question is to do with the insecurity situation in Somalia. We've seen a lot recently news about the monitoring parts affecting us. I wonder what impact that is having on the health situation.
Mitch, you want to take? Can I know your name and the media? Thank you.
No, I think that's a very relevant question. So, insecurity in Somalia, it has always been major challenges. And what we are seeing on the ground in our hospitals, we have a huge number of proportions of the cases of the patients arriving from places outside of the town. And of course, they arrive very late. They have with different barriers of challenges of transportations, the cost to come, and also the limited health facilities that's available outside of the town. And ideally, if security was not an issue for many of the humanitarian actors, we would have gone to the outside of the town to the most affected areas. But unfortunately, with all the security at this moment, we are unable to do so. So I believe that yes, the security has an impact, and I will also use this opportunity to call for all the organizations and committee involved, to call for the safe passage of the patients and also for the safe passage of the humanitarian actors to go and support the most vulnerable populations outside of the town.
Thank you, Mitch. And we have seen instances where there is a conflict and people cannot reach hospital. Because there is a constant admissions, and when there is a conflict for a few days, we see that people cannot reach the hospital. And when they come later on, they come often more sick. I have another question, Mitch. It's more or less, yeah, please. Yeah.
About the potential funding cut of UNSOS, so the logistics part that's moving really everyone around the country. Is that going to affect your operations?
Correct. The funding for the security operators and how?
For UNSOS, so the logistical side of the UN, which, as I understand it, is moving a lot of awesome around, but it's also helping with other things. Is that going to affect you guys, or should you be insulated from that?
I mean, I can talk about the general impact, with the big reductions across different sectors, right? Including the logistics sectors, and of course, all those informations that also important for us to continue our operations, because we are part of the ecosystem where we work in, where the impact on one sector has a direct impact on the health organization, especially with the logistic clusters, with the WASH clusters. And we are seeing that, and we have seen that in the last few months, many of the organizations were depending on, for instance, on supply of the therapeutic food, which is the source, which is the treatment that we give for the malnourished children. Those supplies were interrupted. And this was not because of the supply, because of the lack of supply per se. There were supplies in Mogadishu, but then to transport them, they didn't have this cost to transport them to places like Baidoa. And we saw this firsthand. And as a consequence of this, we also started receiving more patients in our hospitals. And there has been times when MSF has scaled up and started supporting some of the organizations in giving the therapeutic food. So that just has to just to ensure that they can continue the basic life-saving work. We are seeing those impacts.
Thank you, Mitch. I have a similar question. Maybe I can pass it to Alara. Alara, there is a question from Eva from German press agency. And she asks, is it possible to do outreach programs to communities outside Baidwa? And can you give more details on the security situation? So maybe you can tell us about our activities outside the hospital in terms of outreach and how the security situation impacts them. Alara.
Thank you very much. So the security impact on of course, on the daily access for communities who might fall under, of course, certain zones. So the access is not totally blocked, but it's not also very much easy to reach for such areas. And then the response size for the communities that fall outside Baidawa is not up to their needs. So the communities outside have to reach for whether to get healthcare or any other services. The other side of the security with the current situation and worsening is that if in case of any instability, it becomes more of a complex emergency rather than one, as population movement will lead to deterioration in the nutrition program follow-up for children who have to visit regularly our outpatient department for nutrition follow-up and also for pregnant and lactating mothers. Then any instability in the context will delay their next appointment or also a next health visit that they should obtain, which complicate their conditions as patients and at the same time complicate their overall situation. This is in terms of security for access. Some partners could access. It depends. But it's still the response, and Baidawa is a reflection for whatever lack of humanitarian activities going outside in other cities and towns, and at the same time on rural area. It's just a mirror of how the lack of health services and even other services are taking place in this matter. It does not always relate to security. Yes, security is a big factor, but even in some stable towns, they lack basics of service and they have to go only for Baidawa, which put pressure on the services. At the same time, overload the burden on the people who cannot access either for logistical reason or for security reasons.
Thank you, Alara. Yes, please go ahead.
My name is Edwin Okoth. I'm from Reuters. I have two questions. What's the funding gap in terms of dollar numbers? Because you've said you've lost the 70 million that was coming from the US last year. This year it's not there. So can we tell the gap in terms of the dollar numbers? And my second question is on what do you project will happen if the situation remains unchanged for the next year, for example?
Thank you. Maybe Mitch, I can request you, but to begin with, there is a 70 million. US has been one of the major donors over the years. And just last year, if we say it was 70 million that came to Somalia in different forms, including health, and now it's literally zero. We also see, and these are the figures from UNOCHA that coordinates all the funding. From UK government, they have cut down around 50% of their funding. And if we, again, UNOCHA numbers, they were funding for 2.2 billion in 2022 for Somalia. And now it's, I think, around 300 million only so far that the Somalia has gained. Mitch, you want to add anything? And if, like he asked, if this action is not taken and the support doesn't come, where would it take Somalia?
I think in general, there has been a declining interest in the humanitarian situations in Somalia. So what we are seeing now is that the humanitarian fundings are not based on the humanitarian needs, but these are mostly linked with the political decisions. And this is what we are seeing on the ground. Like I think we have already quoted earlier that the humanitarian this year humanitarian response plans, it has been reduced to 882 millions. There's a 40% reductions as compared to previous years. And out of that, only 1/3 of the fund has been secured till August, which is almost like 7 months now. So we are seeing like what I mentioned earlier, that there has been 88% from, like, when you combine and compile all this, 88% reductions as compared to what we saw in 2022 when we had the similar drought. But this time, the drought situation is far worse than what we saw in 2022, and plus the scale up capacity of the international actors and other humanitarian partners are crippled with lots of challenges.
Just to add, the humanitarian response plan identified around 5 million people who are in need, and the funding they have even requested for is already says that they will only manage to able to support half of them. And the organization are going into hyper prioritized mode where they can only do life-saving things. So obviously they have cut down their funding, they have changed their operators of working, and despite that, whatever amount they will get, which they haven't got still, will only help half of the people that are in need. So that's the situation right now. Yeah.
We know compared to 2022, it's worse than what was there. We also know what funding has not come. So what's the ideal and what's the gap that we need to fill in dollar numbers so that we're able to take care of this situation that is worse than 2022? And also the second part is, what should we expect if nothing happens? I think those two are what I really want clarity.
Yeah. Which you want to add?
Yeah. I mean, like, basically, it's not our role to quantify the amount of money that's needed. Okay, but what we can say based on what we are seeing on the ground is that we need, like what my colleague Alara mentioned, like we need a coordinated scale up. Right now, as an organization like MSF, we are trying to focus on life-saving programs. And it's also true for many of the organizations who are still on the ground. They are prioritizing. They have cut off their preventive programs. They have cut off their other, like, there has been big reductions in the WASH programs to focus on the priority, which is the life-saving. But as our briefing note, like, we cannot just keep on continue doing life-saving, because this is a vicious circle. Readmitting patients. But what we need on the ground is a consistent effort at all the different sectors, from livelihood, from WASH to food assistance to medical programs. As MSF, we have scaled up. We are based on the impact that we have seen from increasing our number of beds from 50 to 300, increasing by 300%. We have expanded our malnutrition program to also include moderate malnutrition, as before we were only treating the severe malnourished children, and we have even started treating pregnant and lactating women, like also started treating the adult malnutrition cases. And on top of that, we have adopted a very radical approach in, like, going outside of the medical programs. Like, now we started water since the last 9 months, since declaration of drought. We have been water tracking for the most vulnerable IDP sites. And we are also finding ourselves in situations where we have started, it's very important and very life-saving programs, but we don't know where to stop, because we're not seeing the necessary scale up from different actors.
And I have, Mitch, I have another question online, and you mentioned already. The question is that aside from malnourished children, how is the situation of maternal health, mortality, giving birth, given the nutrition situation? You mentioned that there are a lot of women, lactating and pregnant women, that being admitted, and how is gonna, from the medical side, if you can tell us, how is gonna impact the health of the mother and eventually the child?
Yes, traditionally we have focused our malnutrition program to focus on the most vulnerable population, which is the under 5 children, the children who are less than 5 years old. But based on the current context, we started seeing the caretakers, the women who are bringing the children, acutely malnourished. It's very clear that even without doing the survey, without doing the measurement, we were seeing them firsthand in our clinics. But to quantify, to have a more evidence-based approach, we started screening the nutrition profiles of the pregnant lactating woman, and what we found was alarming. Like, as I mentioned, that we have already admitted in the last 3 months since we started the programs to treat pregnant lactating and lactating women. We have already admitted close to 3,000 pregnant women. That's a very high number. And yes, it has a direct impact, especially in terms of the health, especially at the time when they need increased nutrition. They're already deprived of the essential nutrients. And as a mother, they had to prioritize on the children. So we are already seeing this impact firsthand. that has been presented with different complications in our hospitals. Yeah, I don't have the numbers at the moment, but yes, we are also seeing increase in the number of maternal mortality associated with, and we can say that it has associated and has a direct impact due to the lack of food in the community.
And you also spoke with a lot of women during this assessment.
Yeah, and just to say that in terms of the actual survey, it was approximately, again, 1 in 2 women that were defined as nutritionally at risk based on sort of global standards for what that threshold cutoff is. So it was a substantial number, and there are a lot of issues in terms of just the mothers and their admission into the hospital, especially the pregnant ones who are already admitting another child who needs to be in the nutritional program. They are struggling to cope even more because they themselves are struggling to breastfeed the children that are in the facility, and they themselves are also undernourished and pregnant.
Thank you, Chima. Any other questions from the room or online? Yeah.
Please.
Current tensions that we're seeing in Mogadishu are impacting any of your work in the field?
Do you want to take it? There has been quite a conflict recently in Southwest, and obviously how it impacts service delivery is significant, no? Yeah, Alara, you wanna take this question? The general political situation, because you're in Southwest, so we can maybe start from there.
Yes, thank you very much. Of course, it affects much and lead to complication of the overall humanitarian situation with all its the vulnerabilities. It lead to constant population movement in and out of town. Baidoa is considered one of the most stable. So if you have any instability in Baidoa, then it double the vulnerability of the already internally displaced population. And at the same time, they don't have any other option. So even if it's a temporary displacement or internal movement or external movement, they still come back to Baidoa. It will lead to interruption of some services, as we face this in ourselves. In the drought response, we were doing water tracking, and at the same time, some water and sanitation activities in the community, beside, as Nasser mentioned before, access to health service, either emergency access or regular access. That if the regular access for outpatient department was not fulfilled in time, then the child or mother situation will become an emergency access later. We have seen relapses of patient that even was calculated every 2 weeks after any instability. Then we will see a wave of relapse patient or returning population back to Baidoa after any instability. It impacts much. It complicates the already complex situation on vulnerable community, whether children, mothers, disabled, and elders. We've seen also some miscarriages and some medical emergencies related to maternal health because of this kind of event. Thank you.
Thank you, Alara. If there are no questions, I think we can conclude it here. It's very simple to conclude. The situation in Somalia and in Baidoa is quite concerning. The numbers are shocking. Every second child is malnourished, like we said. Every fourth child severely malnourished, which is actually a life-threatening situation. The hospitals are overwhelmed. The capacity of the hospital has been raised by 300%, and still there needs more. And what is more concerning, that you can treat a child and save his or her life today, but they go back to the community where there is no water, there is no food, there is no healthcare. So it's a relapse, it's a readmission that we are already seeing in our hospitals. And at this very moment, what we are seeing, the humanitarian support from the world is going down, which is quite shocking. So what we call on the international community, that these numbers, these statistics should be like a wake-up call, and they should support Somalia more in terms of treatment of the children, in terms of food distribution, in terms of effective and widespread vaccination campaigns so the lives are not lost. Thank you so much, everybody, for being here and people online. Thank you very much.
In the room, if you have more questions.